Why appendix problem occur? Describe its causes. Treatment. An appendix problem typically refers to inflammation or infection of the appendix, a small, finger-shaped organ located at the lower right side of the abdomen. This condition is known as appendicitis and can be a medical emergency if not treated promptly. While the exact cause of appendicitis is not always clear, several factors can contribute to its development. It is believed to have a role in the immune system, particularly in early life. Obstruction. One of the most common causes of appendicitis is a blockage of the appendix, usually by fecal matter, foreign bodies, or thick mucus. When the appendix becomes blocked, it can lead to a buildup of bacteria, causing infection and inflammation in the body and it cause of a severe pain. Obstruction treatment. The treatment for an obstruction depends on its underlying cause, location, and severity. In many cases, partial obstructions may resolve on their own with consecutive management, including fasting, intravenous fluids to maintain hydration, and bowel rest. However, complete or severe obstructions often require medical intervention. This may involve the placement of a nasogastric tube to decompress the stomach and relieve pressure, as well as addressing the specific cause of the obstruction, such as surgery to remove a tumor or adhesions causing the blockage. Treatment decisions are made on an individual basis, taking into account the patient's overall health and appendicitis is lying condition causing the obstruction. Early diagnosis and prompt treatment are essential to prevent complications and promote recovery. Infection. In some cases, appendicitis may result from a viral or bacterial infection that spreads to the appendix. This infection can irritate the appendix's lining, leading to inflammation or cause severe pain. To reduce infection of appendix, take a good care of yourself. Make a routine of your diet, must intake fresh juices and stay hydrated as well. Enlarged lymphoid tissue. The appendix contains lymphoid tissue, which is part of the immune system. If this tissue becomes enlarged or overactive, it can obstruct the appendix and lead to appendicitis. Enlarged lymphoid tissue refers to the swelling or expansion of lymphoid organs such as lymph nodes, tonsils, or the appendix. This enlargement typically occurs as a response recovery or inflammation in the body. Lymphoid tissue plays a crucial role in the immune system, helping to filter and fight off infections. When it becomes enlarged, it signifies an active immune response. In some cases, persistent or abnormally large lymphoid tissue may require medical evaluation to determine the underlying cause, which can range from infections to immune disorders or even certain cancers. Treatment, if necessary, depends on the specific diagnosis and may include antibiotics, surgical removal, or addressing the underlying condition. Trauma or injury to the abdomen can sometimes trigger appendicitis, although this is less common. Blunt force trauma or a foreign object can cause inflammation or block recovery. Appendix. Trauma refers to physical or emotional injuries resulting from accidents, violence, or other distressing events. Physical trauma can range from minor cuts and bruises to severe injuries like fractures or head trauma. Emotional trauma often involves psychological distress and can result from experiences such as witnessing or being a victim of violence, accidents, or natural disasters. Both physical and emotional trauma can have lasting effects on an individual's well-being, requiring appropriate medical and psychological support for recovery. Treatment for trauma may include medical care, therapy, counseling, and support from friends and family to help individuals cope and heal from their traumatic experiences. Genetics. There may be a genetic predisposition to developing appendicitis. Some people may have a family history of the condition, suggesting a genetic component. Dietary factors. While the role of diet is not entirely clear, here I suggest too that a diet low in fiber may increase the risk of developing appendicitis. In case of rapid diet and diet change, people didn't notice about their diet and had many deficiencies which may cause appendix. Fiber helps prevent blockages in the digestive tract, including the appendix. Age and gender. Appendicitis can affect people of all ages, but it is most common in individuals between the ages of 10 and 30. It also appears to be more common in males. Appendicitis is a serious condition that requires prompt medical attention. If left untreated, the appendix can rupture, leading to potentially life-threatening complications such as peritonitis, infection of the abdominal cavity. The most common symptom of appendicitis is abdominal pain, often starting near the navel and then migrating to the lower right side of the abdomen. Other symptoms may include fever, nausea, vomiting, and loss of appetite. If you or someone you know experiences symptoms of appendicitis, it's essential to seek immediate medical care. A doctor can diagnose the condition through physical examination, blood tests, and imaging studies, such as ultrasound or CT scans, and recommend appropriate treatment, which usually involves surgical removal of the inflamed appendix, appendectomy. Early intervention is crucial to prevent complications and ensure a full recovery. Thanks for watching. Hope you like the video. Please subscribe to my channel and share the video to your friends and family. Stay blessed.